Welcome back to the Vital Signpost. You know, as nurses, we're bound to run into some tough situations, and today we're taking a deep dive into one that's becoming more and more common. It's substance use disorder.
And it really is something that we see more and more often. It doesn't matter who you are, really, your age, how much money you make, or even what you do for a living. It affects everyone, and it's something we as healthcare professionals need to understand to truly make a difference.
And that's what we're doing today, right? We're going to really unpack this complex issue. We'll cover how to spot the signs and symptoms and what treatments are out there. We'll be talking about all sorts of substances like opioids, stimulants, depressants, and alcohol, so you'll have the knowledge you need to face this challenge head on.
But before we get into specifics, let's define some terms that people often mix up, like addiction or physical dependence, and then there's psychological dependence and habituation. Knowing the difference between these is really the foundation for accurate assessments and proper care.
Okay, so let's start with addiction. What does it really mean to be addicted to something?
Well, addiction is a chronic disease, a complex one. It's characterized by this compulsive need to seek out and use drugs even when it's causing harm. It's really important to remember that addiction isn't a choice. It's not a moral failing. It's a disease that affects the brain, changing how it works and even its structure.
So how is addiction different from physical dependence?
Yeah.
There must be some overlap, right? But they're not exactly the same, are they?
You're right, they're not the same thing. Addiction includes physical dependence, but it goes beyond that. Physical dependence is what happens when your body gets used to having a substance regularly, and when you stop suddenly, you get withdrawal symptoms. Take, for example, someone who's been taking opioids regularly for pain. They might become physically dependent and experience things like muscle aches, nausea, or sweating if they stop taking the medication abruptly. But that doesn't necessarily mean they're exhibiting the kind of compulsive drug-seeking behavior that's characteristic of addiction.
Okay, I see. So physical dependence is more about the body's reaction to not having the substance. Addiction is more about those compulsive behaviors and the inability to control your use, even when you know it's bad for you. Now, what about psychological dependence? Where does that fit in?
Well, psychological dependence is all about the mental and emotional cravings for a substance. It's that feeling of needing it to deal with stress, anxiety, or any other difficult emotion. And this psychological dependence can be a huge driver of addiction. It makes it hard to quit, even when you know the consequences are harmful.
So we've got physical dependence, which is the body's reaction, psychological dependence, which is the mind's craving, and addiction, the overall disease. But then there's habituation. How's that different?
Habituation is basically what happens when you get used to the effects of a substance over time, so your response to it decreases. For example, if you drink coffee every morning, you might find yourself needing more and more to feel that same alertness. That's habituation. Now, while habituation can be part of addiction, it doesn't automatically mean you'll develop those compulsive behaviors or lose control over your use.
That's really helpful in understanding those differences. Now let's talk about opioids. They've been in the news a lot lately, and for good reason. The opioid crisis has been devastating, and it's so important for nurses to really grasp the nuances of these drugs.
You're right. Opioids are usually prescribed for pain relief, but they have a high potential for misuse and addiction. They work by attaching to opioid receptors in your brain, spinal cord, and other parts of your body. This blocks pain signals, but also triggers the release of dopamine, which is the neurotransmitter linked to pleasure and reward.
So it's like opioids hijack the brain's reward system, leading to those feelings of euphoria that can be so addictive. And it's not just illegal opioids like heroin that are a problem. Misusing prescription opioids like oxycodone or hydrocodone has really become a major issue.
It has, and unfortunately, many people who end up addicted to opioids started with a legitimate prescription for pain. Their use just spirals out of control from there. The risks tied to opioid misuse are really serious.
Definitely. Overdose is a huge concern, especially now with fentanyl-laced heroin. Fentanyl is incredibly potent, 50 to 100 times stronger than morphine. Just a tiny amount can be fatal, and often people don't even know it's mixed in with the heroin.
And we're also seeing this scary trend of people mixing different substances, particularly opioids, benzodiazepines, and carisoprodol, a muscle
Yeah.
relaxant. This combo, they call it the Holy Trinity, is incredibly dangerous. Because of the way they interact, they really depress the central nervous system. You can end up with severe breathing problems, coma, even death.
It's a truly frightening combination. It just emphasizes how important it is to thoroughly assess and educate our patients. Let's talk about what happens when someone who's dependent on opioids tries to quit. What are the signs of opioid withdrawal?
Opioid withdrawal, while rarely fatal, is definitely unpleasant. The symptoms can be mild or severe, and usually they start a few hours to a few days after the last dose. You often see intense cravings, muscle aches, stomach cramps, nausea, vomiting, diarrhea, anxiety, trouble sleeping, sweating, chills, and goosebumps.
It doesn't sound pleasant at all.
Yeah.
I imagine how severe those withdrawal symptoms are can depend on things like the specific opioid, how long they've been using it, and their overall health.
Exactly. Withdrawal from short-acting opioids like heroin tends to be more intense but shorter, while withdrawal from longer-acting ones like methadone might be less intense but last longer.
So no matter what type of opioid it is, withdrawal is serious, and it needs to be managed carefully.
Hmm.
Thankfully, there are treatments out there to help people get through it and stay on the path to recovery.
Yes, there are. We have medications like methadone and buprenorphine. They can ease withdrawal symptoms and reduce cravings. These medications attach to the same opioid receptors in the brain as other opioids, but they have a milder effect. This helps to stabilize the brain and lessen the intensity of those withdrawal symptoms. And then there's naltrexone. It's another medication used to treat opioid addiction, but it works a little differently. It actually blocks those opioid receptors, so other opioids can't attach and have their usual effect. This can really help prevent relapse, but we don't usually use it in the initial detox phase. It can actually make those withdrawal symptoms worse.
So methadone and buprenorphine kind of help manage withdrawal by providing a controlled, weaker opioid effect, while naltrexone helps prevent relapse by blocking the effects of other opioids. It's interesting how these medications work in different ways to address opioid addiction. Okay, let's switch gears a bit and talk about another class of drug that are often misused: stimulants. We know they increase alertness, energy, and focus, but they also have significant risks when misused.
Right. Stimulants work by boosting the activity of certain neurotransmitters in the brain, primarily dopamine and norepinephrine. This increase in activity gives you that desired energy boost, alertness, and focus. But it can also have unwanted effects, especially on your cardiovascular system.
So while they give you a temporary boost, they're essentially pushing your body beyond its limits. And I imagine the long-term consequences of stimulant misuse can be quite serious.
Absolutely. Chronic stimulant misuse can lead to all sorts of health issues. You could be looking at cardiovascular disease, stroke, seizures, psychosis, and even problems with thinking and memory. Stimulants can also mess with your sleep, leading to insomnia and other sleep disorders. And withdrawal from stimulants, while it's usually not life-threatening, can be very uncomfortable and difficult to deal with.
You mentioned stimulant withdrawal. What kinds of symptoms might nurses see in patients who are going through that?
Well, with stimulant withdrawal, you'll usually see a crash in energy levels. This often comes with fatigue, depression, irritability, anxiety, and trouble concentrating. Some people even experience vivid dreams or nightmares and an increased appetite or cravings. These symptoms can be really intense, making it hard for people to function normally.
Sounds like managing stimulant withdrawal requires a mix of supportive care and sometimes medication to address specific symptoms like anxiety or depression. Now let's move on to another class of drugs that can be just as problematic as opioids and stimulants: depressants. Depressants, as the name suggests, slow down brain activity, producing a sense of relaxation and drowsiness. They're often prescribed for anxiety and insomnia, but they also have a high potential for misuse and addiction.
That's right. Depressants, like benzodiazepines and barbiturates, enhance the effects of GABA, a neurotransmitter that inhibits brain activity. This inhibition is what leads to the feelings of relaxation, reduced anxiety, and sleepiness. But it can also have dangerous consequences, especially when depressants are misused or mixed with other substances, particularly alcohol.
Combining depressants and alcohol is a recipe for disaster. It can severely depress breathing, lead to coma, and even death. And then there's the terrifying trend of using certain benzodiazepines, sometimes called roofies, to commit sexual assault. It's a dark reminder of the dangers these drugs can pose.
Absolutely. The misuse of depressants is a major public health issue, and it's critical that nurses are aware of the risks, the signs of misuse, and the potential for addiction. And just like with opioids and stimulants, withdrawal from depressants can be incredibly difficult and sometimes even life-threatening.
You bring up depressant withdrawal. What are the key things nurses need to know when caring for patients who are going through that?
Well, the symptoms you see with depressant withdrawal can really vary. It depends on the drug, how long they've been using it, and their overall health. Common symptoms include anxiety, tremors, trouble sleeping, seizures, hallucinations, and something called delirium tremens. Delirium tremens is a really serious condition. It can be fatal, and it involves confusion, agitation, and instability of the autonomic nervous system. It's absolutely crucial that depressant withdrawal is managed medically in a safe and supportive setting to minimize the risk of complications.
Managing depressant withdrawal sounds incredibly challenging. It really highlights how vital our role as nurses is in recognizing those signs, providing support, and making sure we're working with other healthcare professionals to keep our patients safe. Speaking of substances we often encounter, let's talk about alcohol. It's so prevalent in our society, it's easy to forget just how harmful it can be.
You're absolutely right. People see it as a harmless social thing, but it's crucial to remember that alcohol is a central nervous system depressant, and misusing it can have some serious consequences. It affects practically every organ in your body. Chronic misuse can really lead to a wide array of health problems.
Let's break that down a little. What are some of the specific ways alcohol can damage the body?
Well, if you're chronically using alcohol, it can damage your liver. That can lead to things like fatty liver disease, alcoholic hepatitis, and even cirrhosis. It also increases your risk of heart disease, stroke, pancreatitis, and certain cancers like breast, colon, and esophageal cancer. And the effects on the brain can be really severe, leading to cognitive decline, memory issues, and dementia.
It's a stark reminder that alcohol is a drug, and we need to approach it with caution. And just like with other substances, withdrawing from alcohol can be really tough, even life-threatening in some cases.
You're right. Alcohol withdrawal can cause a whole range of symptoms, from mild anxiety and tremors to severe hallucinations and seizures. And remember delirium tremens, which we discussed earlier. It's a particularly dangerous complication of alcohol withdrawal that can be fatal if it's not treated quickly.
So, being able to recognize the signs of alcohol withdrawal and knowing how to intervene is critical for nurses. Now, let's shift gears to another substance that's highly addictive and comes with some serious health risks: nicotine. Nicotine is the main addictive ingredient in tobacco products. That includes cigarettes, cigars, chewing tobacco, and it's also found in e-cigarettes and vapes.
Nicotine is a strong stimulant, and it affects both the brain and body in many ways. It increases your heart rate, blood pressure, and breathing. It also triggers the release of dopamine, which makes it so addictive. Now, while nicotine itself might not directly cause cancer, the other chemicals in tobacco products definitely do.
So even though nicotine might not be the direct cause of cancer, it's still very harmful and addictive. And the long-term consequences of nicotine use can be devastating.
Absolutely. Smoking is the leading cause of preventable death in the United States. We're talking about almost 500,000 deaths every year. Using nicotine long-term, whether through smoking or vaping, can increase your risk of lung cancer, heart disease, stroke, COPD, and a whole bunch of other health problems.
It's clear that nicotine addiction is a major public health concern. Now let's turn our attention to the challenges and considerations nurses face when caring for patients with substance use disorder. We're often the first line of contact, interacting with patients struggling with addiction, and it's so important to approach these interactions with compassion, understanding, and evidence-based care.
Exactly. As nurses, we have a crucial role in recognizing, assessing, and managing substance use disorder in our patients. We're often the first ones they see when they're struggling, and our interactions can really influence their willingness to seek help and their overall recovery.
So how can nurses best approach these interactions? What should we keep in mind when assessing and caring for patients with substance use disorder?
Well, the most important thing is to approach every patient with empathy and without judgment. Addiction is a complex disease. Individuals struggling with substance use disorder deserve our compassion and support, not our criticism.
That's a critical point. We need to create a safe space, a non-judgmental environment where patients feel comfortable opening up about their substance use and seeking help. What about the assessment process? What are some things nurses should be looking for when assessing a patient for potential substance use disorder?
There are some red flags to watch for during assessments. Physical signs like tremors, dilated pupils, track marks, or needle punctures. Behavioral changes like agitation, restlessness, anxiety, or paranoia. And cognitive issues like memory problems, difficulty concentrating, or slurred speech.
Those are all important observations. But what about patients who might be hiding their substance use or are in denial about the extent of their problem? How do we handle those situations?
Well, that's where our communication skills are really important. We need to ask open-ended questions, listen carefully to what our patients are telling us, and pay attention to their body language. We also have to be aware that patients might downplay or deny their substance use. It's important to be persistent, but also sensitive in our approach.
So being observant, attentive, and persistent in our questions is key. But we also need to be mindful of the patient's emotional state and the possibility of defensiveness. It's a delicate balance, but getting an accurate assessment is crucial for providing the right care. Now, once we've identified a potential substance use disorder, What are some assessment tools nurses can use to gather more information and determine the severity of the problem?
We have several standardized assessment tools. One that's commonly used is the CAGE questionnaire. It stands for Cut Down, Annoyed, Guilty, Eye Opener. It's a quick 4-question screening tool that can help identify potential alcohol use disorder.
I remember the CAGE questionnaire from nursing school. It's amazing how such a simple tool can be so effective in uncovering potential problems. Are there other assessment tools besides CAGE that nurses might find helpful?
There are. Another one that's frequently used is the Substance Abuse Subtle Screening Inventory, or SASI. It's a self-administered questionnaire with true-false questions to assess for potential substance use disorders. The SASI looks for subtle patterns of thoughts, feelings, and behaviors associated with substance abuse. It's particularly helpful for those who might not be willing to directly admit their substance use.
So CAGE is a great tool for quick screenings, while SASI provides a more in-depth look at potential underlying issues. What about the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5? Where does that fit in?
The DSM-5 is the standard we use for diagnosing mental health disorders, and that includes substance use disorders. It provides specific criteria for each disorder, taking into account things like impaired control, social impairment, risky use, and pharmacological factors like tolerance and withdrawal. Nurses can use the DSM-5 criteria to guide assessments and work with other healthcare professionals to develop comprehensive treatment plans.
So the DSM-5 helps standardize diagnoses and ensures everyone is on the same page when planning treatment. Let's discuss the treatment process itself. We touched on detoxification, or detox, as the first step for patients physically dependent on a substance. Can you tell us more about what detox involves and the nurse's role in that process?
Detox is all about managing those acute physical withdrawal symptoms that happen when someone stops using a substance. We need to do it safely. It's a really important first step because withdrawal from certain substances like alcohol and benzodiazepines can be life-threatening.
That makes sense. Detox is about stabilizing the patient and managing those potentially dangerous withdrawal symptoms. What are some specific things nurses do during the detox process?
Nurses have a vital role. We monitor patients' vital signs, administer medications to relieve those withdrawal symptoms, and offer emotional support and encouragement. We also educate patients about the detox process, the risks that come with withdrawal, and how crucial it is for them to follow their treatment plan.
So the nurse's role during detox is multifaceted. It calls for medical expertise, vigilant monitoring, and compassionate caregiving. Once the patient is stabilized and through that acute withdrawal phase, what's next? What treatment options are there to support long-term recovery?
We have a number of evidence-based treatment approaches that can support long-term recovery. These can be tailored to each patient's individual needs, and often they involve a combination of behavioral therapies, medication, and support groups.
Let's break down those options, starting with behavioral therapies. What are some common ones used for substance use disorder, and how do they work?
Behavioral therapies aim to help people understand and change the thoughts, feelings, and behaviors that contribute to their substance use disorder. They can be done individually, in groups, or with families. Often, they focus on developing coping skills, managing cravings, and preventing relapse. One therapy you'll see used often is cognitive behavioral therapy, or CBT.
I've heard of CBT. It's used for various mental health conditions like anxiety and depression. How is it applied to substance use disorder?
With CBT, we help individuals identify and change negative thought patterns and develop healthier coping mechanisms. For instance, someone battling alcohol addiction might learn to recognize what triggers their drinking, challenge their negative thoughts about quitting, and find new ways to cope with stress and cravings.
So it's about empowering individuals to take control of their thoughts and behaviors, helping them establish healthier patterns. What other types of behavioral therapies are commonly used?
Another effective one is contingency management. It uses positive reinforcement to encourage abstinence and positive behaviors. Basically, individuals are rewarded for achieving certain goals, like attending therapy sessions, having negative drug tests, or maintaining sobriety. It can be a really motivating approach, especially early in recovery.
It's interesting how different behavioral therapies tackle recovery from different angles, but ultimately, they all aim to equip individuals with the tools they need to manage their substance use disorder and live healthier lives. Along with behavioral therapies, you mentioned medication as part of treatment. Can you expand on that?
Medications can be used to address different aspects of substance use disorder. That could be managing withdrawal symptoms, reducing cravings, preventing relapse, or treating co-occurring mental health conditions. Methadone and buprenorphine, for instance, are frequently used to treat opioid use disorder.
I remember learning about methadone and buprenorphine in pharmacology. They're both opioids, but they're used in a controlled, monitored setting to help people wean off more dangerous opioids, like heroin. How do they work?
Methadone and buprenorphine work similarly to other opioids, binding to those same receptors in the brain, but their effect is much weaker. This helps to stabilize the brain, reduce those intense cravings, and prevent the severe withdrawal symptoms that can happen when someone quits opioids abruptly.
So they essentially provide a pathway to sobriety, allowing people to gradually come off opioids without experiencing the agonizing withdrawal that can sabotage their recovery. What about naltrexone? I know that's also used for opioid addiction, but it works differently, doesn't it?
It does. Naltrexone is an opioid antagonist, meaning it blocks opioid receptors in the brain. So other opioids can't bind and have their usual effect. This is really helpful in relapse prevention. If someone takes an opioid while on naltrexone, they won't get that euphoric feeling, making them less likely to continue using.
So methadone and buprenorphine manage withdrawal and cravings with a controlled opioid effect, while naltrexone focuses on relapse prevention by blocking other opioids. It's remarkable how they target different aspects of addiction. Are there medications for other types of substance use disorders, not just opioid?
Yes, definitely. There are medications for alcohol use disorder, nicotine dependence, and stimulant use disorder. Take disulfiram, for example. It's used for alcohol use disorder and works by blocking the breakdown of alcohol in the body. So if someone drinks alcohol while on disulfiram, they experience really unpleasant side effects like nausea, vomiting, and headaches.
So disulfiram basically creates a negative association with drinking, making it less appealing. What about medications for nicotine dependence? There are quite a few options available, but how do they work?
And nicotine replacement therapies like patches, gum, lozenges, and inhalers provide a controlled dose of nicotine to help ease cravings and those withdrawal symptoms. Other medications like bupropion and varenicline target the brain, reducing cravings and the rewarding effects of nicotine.
It's really amazing how far we've come in developing medications to help people overcome substance use disorder. You also mentioned support groups as a vital part of recovery. Can you talk more about the benefits they offer and how they contribute to long-term sobriety?
Support groups provide a safe and supportive space for people in recovery to connect with others who truly understand their struggles. It's a place to share their experiences and learn from one another. They offer a sense of community and belonging, which can be particularly important for individuals who may feel isolated or ashamed of their addiction.
I imagine that sense of connection and shared experience can be incredibly powerful. What are some of the most well-known support groups for substance use disorder?
Alcoholics Anonymous, or AA, is probably the most recognized support group for those struggling with alcohol addiction. It's a 12-step program emphasizing spirituality, accountability, and support from fellow members. Narcotics Anonymous, or NA, is a similar 12-step program for individuals recovering from drug addiction.
Those 12-step programs have been around for a long time and have helped so many people achieve and maintain sobriety. Are there other support groups besides 12-step programs?
Of course. Smart Recovery is a good example. It's a secular alternative to 12-step programs that focuses on self-empowerment, evidence-based strategies, and mutual support. You also have support groups specifically designed for family members and loved ones of individuals with substance use disorder, like Al-Anon and Nar-Anon.
It's reassuring to know there's such a wide range of support available, from traditional 12-step programs to secular options and groups specifically for families. Now let's talk about the nurse's role in advocating for patients with substance use disorder. We've discussed the importance of compassion and understanding, but advocacy goes further than that. How can nurses advocate for their patients who are struggling with addiction?
Advocacy can take many forms. It might be ensuring patients have access to appropriate treatment resources or challenging stigma and discrimination within the healthcare system and society in general. Nurses can advocate by educating themselves about substance use disorder, staying current on the latest treatment options, and knowing what resources are available in their community.
So it starts with knowledge and awareness. What are some other ways nurses can advocate for their patients?
We can also speak up when we witness discrimination or stigma, whether it's from colleagues, other healthcare providers, or even family members. We can educate others about substance use disorder, challenge misconceptions, and promote a more compassionate and understanding approach to this complex disease.
That's an important reminder that advocacy can be as simple as speaking up and challenging harmful attitudes and beliefs. We've covered a lot in this discussion, from defining substance use disorder and exploring the effects of different substances, to discussing the role of nurses in assessment, treatment, and advocacy. What key takeaways do you want our listeners to remember?
The most important thing I want to emphasize is that substance use disorder is a treatable disease. Recovery is possible. It's crucial to approach individuals struggling with addiction with compassion, empathy, and a belief in their ability to change.
That's a message of hope that we all need to hear. What are some other key takeaways?
Nurses are vital in recognizing, assessing, and managing substance use disorder in our patients. We need to be knowledgeable about the signs and symptoms of addiction, the various treatment options, and the resources available in our communities. We need to be thorough in our assessments and documentation and always advocate for our patients.
Those are all critical points. We have a responsibility to provide the best possible care for our patients, regardless of their struggles. That includes those battling substance use disorder. Now, I know there are many ethical considerations that come into play when caring for these patients. We'll delve into those ethical dilemmas in more detail in part 3 of our deep dive, along with strategies for self-care and preventing burnout. Welcome back to the Vital Signpost. As we wrap up our deep dive into substance use disorder, I want to bring up something that's often overlooked but so important, and that's the ethical considerations we face as nurses when caring for patients struggling with addiction. These can be really complex situations that force us to carefully weigh different values and obligations.
You're absolutely right. Caring for patients with substance use disorder often presents these ethical dilemmas that can be tricky to navigate. We have a duty to provide compassionate, competent care to all our patients, but sometimes substance use disorder throws unique challenges our way, challenges that really test our ethical boundaries.
One of the most common ethical dilemmas we face is balancing our duty to protect patient confidentiality with the need to protect others from potential harm. You see, substance use disorder can impair judgment and increase the risk of impulsive, dangerous behaviors, which sometimes puts the patient or others at risk. So how do we reconcile those competing obligations? When is it okay to disclose confidential information to protect someone?
That's a tough question, and there's not a one-size-fits-all answer. We have to look at each situation carefully and consider a number of factors. What's the severity of the substance use disorder? What's the nature of the potential harm? Is the patient willing to seek treatment? What support resources are available? It's also crucial to talk to colleagues, supervisors, and ethics committees when facing these difficult dilemmas. Getting different perspectives can help us make more informed, ethically sound decisions.
So open communication and collaboration are key. We need a culture where nurses feel comfortable seeking guidance and support when they're navigating these ethically challenging situations. And we can't forget that our primary responsibility is to our patients. That includes protecting their privacy and confidentiality whenever possible. Now, beyond confidentiality, there are broader ethical considerations when caring for patients with substance use disorder. For example, how do we make sure we're providing equitable, non-discriminatory care, especially given the stigma and negative attitudes surrounding addiction?
That's a crucial point. We need to be aware of our own biases and judgments and ensure we treat all our patients with respect and dignity, regardless of their past substance use. We also need to advocate for policies and practices that promote equity and access to care for these individuals.
Advocacy is such an important part of our role, and it's even more critical when caring for marginalized populations, and that includes those struggling with addiction. Now, apart from the ethical considerations, caring for patients with substance use disorder can be emotionally draining for us as nurses. We're constantly facing suffering, trauma, and loss, and it's easy to experience compassion fatigue and burnout. So how do we take care of ourselves while still providing compassionate care to our patients?
Self-care is essential for nurses, especially those working in demanding areas like substance use disorder. We have to prioritize our own well-being to continue providing compassionate and effective care. Self-care looks different for everyone. Some essential strategies include setting boundaries, practicing mindfulness, finding ways to reduce stress, seeking support from colleagues and supervisors, pursuing hobbies that bring you joy, and making time for rest and relaxation.
Those are all great suggestions. It's so easy to get caught up in our work and forget about our own needs. But self-care isn't selfish. It's vital for our health and well-being, and it allows us to be more present and effective for our patients. And I think it's important to remember that seeking professional help for compassion fatigue or burnout isn't a weakness. It's actually a sign of strength. It shows a commitment to our own well-being and to providing the best care for our patients.
I agree completely. There's nothing wrong with asking for help when you need it. It's a sign of self-awareness and a commitment to personal and professional growth.
Well, we've covered a lot of ground in this deep dive into substance use disorder. We've explored how complex addiction is, the effects of different substances, the challenges of assessment and treatment, and the ethical dilemmas we face. We also discuss the importance of self-care and prioritizing our own well-being. Before we finish, I want to say again that substance use disorder is a treatable disease and recovery is absolutely possible. As nurses, we have a unique opportunity to make a real difference in the lives of our patients battling addiction. By approaching them with compassion, understanding, and belief in their ability to change, we can help guide them toward recovery and a brighter future. Thank you for joining us for this essential conversation. We hope you found it informative and empowering.
Thank you for having me. It was a pleasure to share my insights and experiences.